So this is what we look like on
I
this
know.
podcast.
Yeah.
Now, a lot of people just listen to podcasts, so they might not see our beautiful view of downtown San Jose, I guess. We're at San Jose State University, where we are at a hackathon. And my name's John Miller. And I've got a guest with me who did a keynote, and I didn't get a chance to hear about it or your company and what you're doing. So I thought, let's talk on the podcast. So let's start at the beginning. Tell us, who are you? Teach us a little bit about yourself.
Yeah. Thank you for having me in the podcast.
Okay.
My name is Zara Hajihashemi. I am the founder and CEO of Cybele Health. A little bit background. I was on the engineering side, computer science for my undergrad, AI robotics for my master's. Then I moved to US for my PhD. And I was an IHS scholar applying machine learning for healthcare. So I got a chance to work with a lot of doctors, nurses, medical setting, ingesting data that came from in a form of time series data and build a model that can predict if there's going to be any health decline in the future. So building preventive models. And after that, I joined Apple, working in cloud infrastructure, working with another type of time series data came from servers and data centers. So I worked there for about 6 years and doing pretty much the same AI things.
So predictive analytics based
for the
on
servers.
time series data like server logs. And for those of us who aren't as technical or who have worked in such cool places, teach us, what does that look like? Like, give us an example. What's in a server log? When you call it time series data, make me a little bit smarter about time series data in the medical setting and then time series data in the server monitoring setting.
Right. That's a good question. So the time series is anything that has a sequence or a notion of time or order in it. So when you talk, your words are a time series data because the order in the words matters. If you are wearing any watch, a smart watch, and it's collecting your heartbeat, your temperature, it's collecting in a different time episodes, and every time it's recording a number, it's recording with a timestamp. And that makes it a time series. So the order or the time matters, and that's called a time series.
Okay, so it's a series of
events,
that happen over time.
Yes.
Dude,
Said
I
it really well.
like taking these little breaks and making it plain English because not because everybody needs to know that listens, but for some of us that don't know, it makes it more engaging. So I understand time series data from the watch. It's measuring your heartbeat or something. Now teach me one example or something I can understand about time series for a server. Did you say you were getting server time series?
Right.
Like, what would you be monitoring? The heat of the server or what it's doing, or teach me a little bit.
Sure, yeah. So from the data center perspective, it's a lot of different things that goes into make all the machines. That these are basically small computers that are running constantly processing all the data. So it's a lot of different things from the infrastructure and facility. What is the cooling, the temperature, the lights, all of that, to every single machine that's working. If they have electricity, they have to be also at a specific temperature, to all the services, and by services I mean apps. So if you're a iOS user, if you have a MacBook or a iPhone, all the apps that running in your system, in your device, is sending signals to the server. The bare minimum is that I'm alive. I didn't crash. I'm doing this. I have a user. Yeah.
Each app is generating a series of things.
Generating a lot of time series. Yeah.
And I don't mean to diminish your expertise by forcing you to teach me like I'm a child, but I really appreciate it. So I thank you for doing it. So now that you've taught us a little bit about your previous superpowers, what's this new superpower or this new thing that you're starting?
Yeah.
And teach us, why did you name it what you did? Like, just teach us how to relate to your company.
Yeah. So I was always fascinated by the intersection of technology and healthcare. It's a lot of things in healthcare that has been historically doing by people manually. And one of the sides of that, it's really good because you need human connections and interactions. But then the other side is that the ability and capacity of humans are really limited. And there is the other fact that human error is always there. I experienced a lot of that. It was very innocent, like out of the blue, really. Human error that results in human lives. So that's the extreme, but also like a lot of inefficiency that brings into the system. And there are a number of reasons. One is that because a repetitive task has to be done over and over and over and again, that reduces the efficiency. Also, some of the tasks that are very rare, so it's hard to really get good expertise on that. And as a human, we are also limited by our energy, our days. So it's a lot of things that's going on that can automate it. We can automate it with technology and have the human just to supervise it instead of doing it.
Well, so what inspired you? Everybody, my understanding, maybe only from TV shows, is that people that get into a medical or a health company, there's usually an inspiring moment, personal, or my mom or my dad, and without feeling awkward or making you more awkward than you want to be. Tell us, was there an inspiration for why you wanted to do this? Tell us a little bit about your motivation.
Right. So
speaking of solving this,
sure. Speaking of time series, obviously, like the pandemic was the bigger chapter in my life, as it's been for pretty much all of us. That got me thinking more seriously about that. I really enjoyed the work that I did in my PhD dissertation, working with the doctors, creating something that you can see impacts humans at different level. But also during pandemic, I got me more thinking seriously about that, how we could have like predict a lot of those, how we could have addressed those much in advance before they become a major problem. And that requires to correlating events with when they occurred. So it's a lot of time series data again.
No.
And we are limited by our brain. We cannot do all of that correlation. So that was the point and it was also a lot of my personal struggles. I just welcomed my second one. I was just out of the maternity leave and the pandemic happened and had to be at home. So yeah, but
well, congratulations, first of all, because having little people is one of the great learning experiences of life.
Sure.
And congratulations.
So what we are building is a combination of that. I can ask you a question. Do you remember the last time you went to a doctor office for a visit?
Yeah. So sure. Yeah.
And do you remember after you left, did you have a question that you forgot to ask the doctor?
Always. Sure.
Always.
Of course.
So so it's always happening. And now the solution is that you either previously we did Google search, now we are asking Gemini or ChatGPT, right? And they came up with all sort of wild answers that we don't know which one could be true or we could trust. And then the other option is to call the office, ask. Obviously, the doctor is not available, so you have to wait, or you have to send a message and you have to wait. Now, what we are building is the digital copy of your doctor.
Okay, so you're creating a digital copy of your doctor.
So when you leave the office, the doctor does not leave you. It stays with you. It's in your phone. You have a question, it's just on your fingertip. Ask the question and the doctor will answer you.
Okay. And teach me a little bit about how your company is approaching that specifically or differently than other companies. Because it feels like, and I'm nowhere an expert, but there's been a lot of companies that I've seen that have been saying, we're going to somehow provide doctor-like services through AI. So teach me, why did you decide to do that when it feels like a lot of people are doing that? And what did you think that you could do better than everybody else? Or how do you teach me how to think about that?
Definitely. Those are great questions. So we call it prescribed AI. Just the same way that you go to your doctor screens you, does some, lab work or screening or test, and then they prescribe you a treatment or medication. The same way they can prescribe you an AI agent. So the doctors are in the loop. The doctor is the one that initiates that. That's the first differentiator.
Right. So, and I'm interrupting you out of hopefully gracefully to allow you to teach us all. So, what you're saying though is that something I didn't hear is that this is with your doctor, the human being you've come to trust, they are part of the loop in prescribed AI. Yes. So teach me how to think about that.
So our app is available and online. And today, if any of the, our audience download it, you don't see the chat option available. Okay. It's because a doctor has not seen you yet. So a doctor has to see you, and they have to diagnose you. They have to decide whether this is a good addition and support of the treatment, and then they can assign it to the patient. So that's resolving a lot of liability around AI entering into healthcare.
Right. So the doctor is the one that says, in this example, I believe prescribed AI would be a good addition to how the patient can use my advice whilst I'm taking care of other folks.
Yes, or have extended support of me because they need.
Okay, well, so teach us more. Like, I didn't even ask you I haven't asked you a million questions.
Right.
But that's okay.
Yes.
What do you want to teach me next?
The next thing is that, again, remember the last time you were in the doctor visit.
Okay, sure.
How did you decide to go to that doctor specifically?
Oh my God. One of the great pains of my life is finding a doctor.
But why does it matter? You can go to the first or nearest urgent care and just ask for a doctor.
Well, okay, but you're revealing my lack of understanding of the system we live in. I've recently become aware of urgent care as being the first place I can go anytime I need urgent care. So that's where I'm at on the spectrum. I've just learned that. I broke my toe and I went there first. So now I get that. But if I want to.
But would you do that next time?
If I broke something.
If it's very urgent. Yeah. If it's very urgent. But if it's not urgent, you prefer to go someone that you have built a relationship with.
Okay, exactly.
Right?
And that's
so you have
why
a trust
I still go back to
your doctor.
Yeah,
because
I trust them. And
you trust them.
They've heard my silly story.
Right.
They've written down some of it.
Right.
So that when I go back, they can say, "Oh yeah, you got fired 6 years ago or whenever it was, a decade ago, and it really affected you and you were worried about that."
So how we are different, your previous question, it's the other thing that you're not the only one who don't go to the urgent care. I don't go to the urgent care as my first choice unless this is really urgent. And the important part is the trust. My health is the most important part. And that's where the trust. Now, the trust comes from, I have to do my research. I have to read reviews. I have to ask my friends around, how was their experience going to that doctor? Because going to the doctor is not, I want to get my coffee today and tomorrow I might try another coffee shop. It's like my health, it's my life. It's a lot of things that goes into that. So that's the main differentiator between my company, Cybele Health, and others, that we are replicating the same way that doctor talks and treats and diagnoses.
Okay.
Versus the other competitors that are using the same LLM that was trained a little extra on some medical data, and it behaves across all the doctors, all the patients the same.
Yeah, okay. So you just said some cool stuff that I want to drill into. Teach me. I keep hearing you describe the name of your company, but I don't know what you said. What is it called?
Cybele.
Cybele. How do I spell that?
Cybele. Cybele.
Cybele.
Yes.
CY. I don't know why that's so weird for me. Maybe it's a word I don't know. It
is one
Cybele.
of the, I can tell you the story about that.
Yes.
So the name shows the story and the history of the company. It started with me as a young mom dealing with a lot of health issues, obviously, in the midst of the pandemic. And I wanted to build a system where can nurture and cure everything related to health, medical and physical.
Sure.
So I wanted to build that infrastructure layer.
Yeah.
That is not very point solution, and it's not only one single specific specialty. It can cover everything, pretty much like an urgent care, right? So you go there, they cover a lot of different things. And then I was looking for something that could be the root, the backbone, the infrastructure. And I come from Middle East, and I'm really passionate about the ancient works and gods and goddess. So I found that name. So Cybele is one of the Greek goddess that gives life and nurtures everything else. So that's the backbone. That's the infrastructure. Everything else grows from it.
Okay, beautiful. Well, that's what I wanted to hear.
Sure.
All right, because there's always a good story.
Yes.
And Cybele now makes sense. Okay, cool. And where are you on your journey with Cybele? Are you pre-seed, seed, Series A? Like, are you working in your garage? Have you raised money? Teach us how to think about where you are in your journey.
Right. Well, there's a funny story about that too.
Good.
I was working at Apple, obviously, and I was working on a very kind of a secret project, to be honest. I was the
Everything
tech
is
lead.
secret at Apple. Is all.
Yeah. I was a tech lead, so I had a very important role, but I was always also, there was something that bugging me that it's gonna be late, it's gonna be late. So I finally decided to give my resignation letter to my manager, who was one of the directors at Apple, and he said, "Can you wait just 6 more months so we finish this?"
Yeah.
And I was kind of seeing the wave of AI and everything coming in. So I said, I really love the project and the team and everything, but I think that it's the momental time for me. And I said no, and I left. And a year later, I emailed him and I said, "Do you want to invest in my company?"
Yes, I'm correct.
And then we talked, and he did. So we bootstrapped 2 checks from my previous managers at Apple and one of the doctors, so 3 checks. One of the doctors who believed in our mission, and I'm very grateful for their trust. So we are live now with some beta customers. Our app is available, and now we started to fundraising for pre-seed stage. We're a team of 5 engineers from Apple, Google, and Microsoft, and we have a great clinical also leaders in our team. Dr. Dustin Weissman, who is the president of California Psych Association, is our chief clinical officer, who is leading all the clinical work and relationship with the community.
Now that is fascinating. So are you seeing, there's so many things that are fascinating. So teach me, is there a particular, like you mentioned, is psychology?
We started with behavioral health.
Oh my God. Well, so teach us how to think about let's get away from the engineering, the thing, because I love that.
Right.
But now teach us, where are you starting your clinical impact? Like, how did you choose where to start, and what would be Cybele's first area of specialization?
Right. That's a good question. So as I was thinking and researching the market, where are the specialties that require a lot of frequent follow-ups?
Yes. Yeah, of course.
So it's not like one-time thing. You have to go back again and again and again. And why that is because those are the specialties that the disconnect makes a lot of disadvantage.
Oh my God. Okay. Of course.
Yeah.
Now that you've said it, of course. So what did you learn?
The doctors and the patients has to be really connected because our health is continuous, but the way that the care is provided to us is episodic.
Yes.
As just one session, depending on which specialty, it can range from 10 minutes to 50 minutes max.
Exactly.
And then it happens, if you're very lucky, every week or every twice a month or once a month, so there are lots of different sectors that requires this frequent follow-up, and the agentic workflow and the replication digital clone of your doctor can cover the gap, and behavioral health is one of those.
Okay, so I want to know where in behavioral health, but I also want to know digital clone of your doctor. I gotta pull that string and find out what you mean by that. But is there an easy answer to the behavioral health where you're focused, or all behavioral health?
For the simplest example, you can think of it as a therapy.
Dude, well then how do I not have this? Why aren't we all using this? I would think therapy is sort of the key. Okay, now. So I gotcha. Digital clone of my doctor. Doctors want this?
Doctors want this. And I tell you why. There are multiple reasons why doctor wants the digital clone. First is that if they are a doctor and they are sitting in the office to provide care, that means they care about their patients. But they are limited. They are limited to the time. Right. They cannot make themselves available to you as and if you need it.
No, exactly. And it's like weekends and
Extra hours. They want to
major
take some time
events.
off. They
Yeah,
want to go to
they need
vacation,
to,
but your
yes.
health happens.
Health
So
happens independent of their vacation schedule. Okay. How do you convince a doctor to trust you that you can clone them? And then how does the consumer or the patient trust the doctor? Which one do you want to start with? Teach me how to think about that from a trust.
Sure. That's the greatest point of, or the most important point of all of that. The
Trust is the
trust
only
is
thing
there.
that matters.
The only thing matters. Well, so the trust between the patient and doctor is already there because
Right.
they are at the same office. They trust the doctor by their life. So whatever a doctor is prescribing for them to take or eat or do the test or
So the
use
doctor
that.
has an inherent trust relationship with the patient.
Yes.
And if the doctor says, "Hey man, you want to try this little app on your phone?" And I'm assuming it's an app that goes on your
Yes,
phone.
that's right.
Then I'll use this prop then. So you're saying AI can be on my phone so that when I go see my doctor, he or she can prescribe using this.
Yes.
And I'll trust that this because of them. But how do they? How did you convince them that you're not just some other crazy technologist who thinks they can solve the world's problems with AI?
Yes, that's right. Well, there's two components to that. First of all, I don't target them. Dr.
Okay.
Weissman does. So it comes from a colleague.
It has to come from somebody in the community.
Yes.
Right? It can't be one of us outsiders
No.
that doesn't belong.
Right.
We have all kinds of fancy ideas about what we think.
Right.
It has to be a trusted human being in the community who says,
That's right. Yeah.
"Hey,
And then
man,
the second part is that they are already dealing with this problem. And then what are the other options? The other option is to hire a staff, train in a staff, and even that staff is only 9 to 5. She's not available in the weekend. She's not available after hours. Even that staff needs to take time off. They get sick days. They get to vacations. And then the other part is that they have to be involved in some sort of messaging system. Either this is a MyChart or email.
So does it work with MyChart? Or
Yeah, we do integration with their EMR system.
Okay. Okay. And is there any place in San Fran that's using this right now? Like, can I get my doctor to help me? Although I need I need
board.
uh, uh, what psychiatrists or
We can work with any specialties. We started with mental health, but now we're seeing that physical therapists want to work with us, nutritionists want to work with us. Anything that's related, like pain management, like diabetes, Alzheimer's, everything that relates.
Well, so where are you starting?
So we started with mental health, and we are gradually
Are you
expanding.
any
In
hospital
the Bay
group
Area, no.
or
So there is a so
teach
in the
me how to
healthcare, there are two categories of how the facility delivers care. It's called inpatient care and outpatient care.
Okay.
Inpatient care is hospital because you admit patients in and then they might stay overnight.
Yeah.
Whereas outpatient care is any facility like urgent care, like an individual practice that you go, you visit, and then you go home.
Yeah.
And they work very differently. So our focus is outpatient care. So we're not in hospitals or clinics or like anything that's related to that yet. We started with outpatient care. So we are directly working with doctors who have their own private practice, some specialty clinics. That means a group of doctors work together under the same roof, but they see and treat their patients individually. So that's our first batch of users or providers.
Is there anything you want to ask me based on the questions I've asked or the product you're bringing to market? You've already asked me a few questions, but is there anything you want to ask me? And then I'll trick you with this super great question. Is there anything I should have asked you that you want to talk about?
There is one question that I've been asked a lot is that how is that different from ChatGPT? Why can't I just ask my health question from ChatGPT?
That's a good question. Why is this? Yes, no, exactly.
Yeah.
Why am I not just using the latest ChatGPT or Gemini or whatever?
Well, the difference is that the ChatGPT does not know the context of you and your doctor. That's the first part.
One, they don't know you from a hole in the ground. They might have some memory, but they don't have any medical context and they don't have the doctor's notes about what you have been talking about forever. Right.
They don't have the context. And the second thing is that there is a reason that you chose your doctor, other than any other doctor. So the tone, the language, the vocabulary, the style of the treatment. So that builds the trust between you. So and also in some particular specialties, including behavioral health and mental health, it's like dating. You try different therapists, and the synergy is not just there.
And if you're not, and if it doesn't work, it doesn't
It
work.
doesn't work.
But if it does work,
yes,
you want more of that juice.
you want more of that. You want to get more time with them. So that's where a digital clone makes a big difference.
Okay, so I should have asked, what is this digital clone like? Is this something like, do I talk to it? Is it a picture of my doctor with moving lips? Like,
right. As someone in technology, I was really into let's build your avatar that speaks just like you. And then Dr. Weissman was like, whoa, wait a minute. That's not how it's gonna go.
That's just weird and creepy.
No, yeah, it's very weird. So currently it's only text-based. So it feels and looks exactly the same as you ask ChatGPT. The only difference is the result that you get. The result that you get, the vocabulary, the topics, that's one thing. The other thing is that there are a lot of guardrails around the things that a bot should not do because of the liabilities of that. So that's the second. And the third is that doctors can oversee a summary of the conversation. So they are also up to speed. So the next time you go to your visit, you don't have to spend half of the session just talking about what happened.
Yes.
They're
So
already
it
safe.
allows the history and discovery of that. And if the doctor wants to lean in when you come back in, holy cow, it sounds like you had a crazy week. La 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 la.
Right.
Do you want to tell me a little bit more about
Sure.
that?
Yeah.
Okay. So this is fun. Cool. Is it multimodal yet? Are we talking? Is it speaking?
So we are adding
pictures and stuff like
for the liabilities, and there's also lots of regulations in the health, but different sectors is different. So for nutrition, patient are allowed to upload pictures because they do tracking of the foods. In behavioral and counseling, it's a no-no. And then in physical therapy, they can record themselves doing the activity, and the AI, assist them to
So you're already
adjust.
thinking, is it already in the product or is it?
It is building, and we are on a beta test with doctors on a limited focus, and then we'll make that available.
I love it, man. I'm so glad we met
Thank
today, and I got to learn a lot about how to think about you, civil, and prescriptive AI.
Prescribed AI.
Prescribed AI. Okay, dude. Okay, well, thank you.
Thank you for listening and watching, and hope to see you at Cybele.
Okay, well, so actually, now I think there is a way. You should tell people how to reach you. And I could put some links at the thing, but how do they reach you?
Right.
Plain English.
Well, you can go to Cybele, Cybele, cybelehealth.com. If you are a provider, there's a link there. It's for free. You can join. If you are a patient, you can still join. We have lots of educational material, or you can ask your doctor to prescribe AI for you.
Okay, well, dude.
Thank you.
We did it. Okay, I'm going to turn off recording. Thank you all.